Singapore General Hospital is Singapore's flagship tertiary hospital. Together with the 5 national specialty centres, the SGH Campus has the largest concentration of healthcare services. Having a very big campus with very diverse and comprehensive clinical specialties allow us to answer and solve many of the clinical issues for our patients, their family, and also for our staff. We want to ensure that the patient's journey through the campus is a seamless one. In that sense, we want to create an environment of a one campus. With the SGH and the 5 national specialty centres, we would have a complete suite of clinical disciplines that could offer solutions to all our patients' clinical problems. Multidisciplinary collaboration is critical, especially in the setting of tertiary academic medicine. Medicine is complicated and not everybody would know and understand the full spectrum of clinical work. Clinicians and also including nurses and allied health need to come together to tackle very complicated clinical problems. With the way how modern medicine is conducted, IT allows us to connect people, to be on the same page, helps to send information in a very rapid way so that people are always able to find each other's data so that the patient care can be improved tremendously. We also employ newer techniques of treatment, and this includes the latest robotic surgeries. This allows us to equip our surgeons and our physicians the latest gadgets and devices and equipment for them to be able to tackle very complicated clinical problems, and this has been useful for us to be comparable to world-class centers in other parts of the world.
I believe research is one of the key pillars of SGH. I always say that in order to be a good researcher, it helps if you are first a good clinician, because the motivation for us to do research is always to improve care for our patients. So one of the key features of our work here at the SGH campus is we place a lot of emphasis on being up to date, both in our clinical science as well as in the research that we do. One of the things that I was involved is a project called the AutoPulse. That is actually a mechanical chest compression device. Now the problem with traditional CPR is that it's dependent on the provider. With a machine, it never gets tired. It always delivers very consistent compressions. You can be assured of the quality of CPR that is ongoing. Since then, I think for the last 5 years, it has become part of our standard practice in the emergency department in Singapore to use this mechanical device.
Our project began in 2005 when a group of us started noticing these strange and unusual fractures in patients that had been on treatment for osteoporosis for a few years.
After the paper was published, we went on to do more work on the topic itself, and one of our works has been recognized and actually obtained an award at a major European trauma meeting in 2010.
The FDA convened a panel looking into this particular type of fractures and has since then gone on to issue a series of guidelines regarding how long we should treat patients with osteoporosis and signs to look out for to prevent this fracture from happening.
Right now, we are also in a collaborative clinical trial. My colleagues in the United States actually approached us to do a collaborative trial in the minimally invasive treatment of tennis elbow. And during our negotiations, we are in the process of even making SGH the Asian a center for this procedure for us to train other centers, really making us a center of excellence for them.
More than a decade ago, leukemia was considered as a death sentence by many, but advances in medical research over the past 5 to 10 years have improved the survival of patients significantly. But we know that more needs to be done, and more can be done. In the space of 2 years, we screened over 100 leukemia patients with drug resistance and detected mutations in 43 patients. As we were the only center in the region to have this test available, we had many patients coming from Malaysia, India, and even China for this test.
So in the SGH campus, where we have many aspects of practice, clinical practice, teaching and research, there are mentors all over the place. I've always had good mentors, and my mentors before me had good mentors as well. And these relationships are important because to somebody who's just starting out in a medical career, in a very busy campus, a very complex campus like this, they need somebody who can show them the ropes of how to survive on a daily basis.
We teach a variety of different students, so ranging from the medical students from the different medical schools, Yong Lulin School of Medicine, as well as the Duke-NUS. We also teach nurses and nursing students. In addition to that, we teach postgraduates, from the junior doctors all the way to advanced trainees like the registrars.
SGH Campus is the first one to use simulation training to train doctors and nurses to work as a team for emergency situations. The importance of team-based training is because in the real life, doctors and nurses work together and not in isolation.
We always encourage our staff to go beyond working in the wards or in our outpatient clinics. For them to go out to the community and then help the senior citizens is a very meaningful event. And this utilizes actually our nurses skills, our occupational therapist skills, also organizational skills where we can provide some sense of relief, comfort, and also actually we teach our senior citizens how to live a good life. A lot of collaboration and cooperation for the One Campus vision has been ongoing. We have numerous successes, and we hope to build on the successes for people to understand that by doing so as One Campus, we would actually make the journey for patients, for all our staff, a much more fulfilling, more exciting, and a more eventful one.